The NHS chief admits that COVID treatment priority tools existed despite years of official denials. We're going to read into this more from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from iNews with the headline that NHS chiefs admit that COVID treatment priority tools existed despite years of official denials. A COVID-19 decision tool was drawn up by officials at the height of the first wave in 2020 to decide who should be prioritised for care. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. While we always talk about when we look back at COVID, back on COVID, and the COVID inquiry continues to look at all of the information, while of course much of the anger and frustration has to be led at the government because they were the ultimate ones who make decisions about our lives, there also has to be some frustration and anger at NHS here, that how something like a COVID-19 decision tool, something that would be able to make the decisions on behalf of them of who should get vaccines, who should get treatment and whatnot, because we know that the NHS was overwhelmed. We know that the NHS was struggling. We know that they couldn't cope. And we know they weren't getting enough support from the government. We know that. But were there decisions that they could have made within NHS without the need for the government to be able to save more lives and be able to do more? And I think that's a question that needs to be talked about as well. I want to make this very, very clear. My frustration will always be towards this but towards the previous Conservative government under the Prime Minister Boris Johnson, who allowed so many people to die while he decided to party. This baffling buffoon should be nowhere near government, but unfortunately there are people out there who suffer from short-term memory of a goldfish. But I do have questions about the NHS and what they were doing during that period as well. And clearly there wasn't a coordinated plan between the National Healthcare Service, the Conservative government, and social care as well. Clearly things were kind of thrown around. Now, again, some people will say, well, Regan, you have to remember that everyone was off their feet and they were running around, and that's true. But there has to be a decision in agreement from all sides, and maybe perhaps that was not the case. So let's read a bit more into this, you guys. So, the existence of an official NHS tool ranking patients by age and fitness to decide who should be given the priority for COVID treatments during the pandemic has been revealed for the first time. The COVID inquiry heard on Thursday how the COVID-19 decision tool was drawn up by officials at the height of the first wave in 2020 to decide who should be prioritised for care, with patients given points according to their age, fertility and pre-existing conditions. So that would have been able to better decide what to do with that patient based on certain factors. Professor Sir Stephen Powis, NHS England's National Medical Director, said he was terrified the NHS was going to be overwhelmed as officials drew up the document and the virus swept through the nation. So what happened to it? In the end, it was never officially released because the UK was nearing its peak of the first wave, Professor Powis had said. However, its existence has confirmed long-held fears by families bereaved by COVID that doctors and nurses unofficially use such methods to rank patients and deny intensive care and other treatments to the elderly and with other conditions. Many members of the COVID-19 Bereaved Family for Justice UK group lost loved ones because do not attempt to resuscitate orders were imposed on them, often without family consent. That's disgusting. So they were told to let them die. Allegedly. The eye has also previously revealed cases where patients were given ward-based ceilings of care orders in their hospital notes, meaning they were not admitted to intensive care units despite being gravely ill with COVID. Yet for years, the NHS and the Department of Health had denied that any decision in which care would have been given or denied according to different groups of people were acceptable in the health service during the pandemic. It's bad enough that we knew that that a lot of money was given to friends and mates so that they could create crap masks at the expense of taxpayer money. It's bad enough on that. What's even worse is that those weren't told the truth about decisions that were made in the NHS, and they denied them. On Thursday, the COVID inquiry heard how the COVID decision tool was written in March 2020 as a prioritisation document to be considered should the NHS become overwhelmed with cases. Professor Powis told Lady Harlett that the work was something nobody ever wants to do. The inquiry was shown the unpublished document titled COVID-19 Decision Tool, which highlights 3 elements to consider when prioritising care, age, clinical fertility, and comorbidities. I hope I said that right. Patients were given points based on their age, with under 50s placed at 0 and 80-year-olds starting at 6 points. It also rated patients from 1 to 9, 1 being fit and well and 9 being terminally ill, where comorbidities such as previous heart attacks, high blood pressure and heart failure also scored points. A point was taken off for women, meaning men were seen as more clinically frail. The scores would then dictate what sort of care should be prioritised to the patient. So rather than just trying to treat everyone and look after everyone, they prioritised. Professor Powis said, in terms of this decision tool, which was never authorised, it was never officially released. It didn't go beyond this stage, other than the group that developed it subsequently published a version of it in an intensive care social society, a set of principles around decision making. The inquiry heard that the impetus for the document came from the Department of Health and Social Care, but on March the 28th, a decision was made that it should not go ahead. Professor Powis added, this was at a point in March where cases of COVID were rapidly increasing. The strategy that the NHS and government had taken was, on one hand, to put social distancing, in other words, lockdown, to reduce the rate of transmission, and within the NHS, our job was to surge capacity. But at that point in March, the number of patients with COVID in ITU, intensive care beds, was doubling every 5 to 7 days. We couldn't see, because there was no community testing at the time, that was likely to come ahead. Professor Powis added that at that stage, it was not clear whether the public would respond to lockdown. He added, frankly, I was personally terrified that the NHS was going to be overwhelmed and doctors were going to be placed in a position, and other clinicians, where they would not be able to make professional judgments that they usually make in terms of treatment and escalation. And in those circumstances, and my clinical colleagues and CMOs, medical chief officers, felt that they should begin to explore a decision tool such as this. But the discussions about the document was halted because a number of us, the chief medical officer, myself with input from the then chief executive of the NHS, came to the conclusion that it should not be released. He said that the perks of the pandemic was approaching and therefore it would not be needed. Professor Powis added, it became very apparent to me that it was not going to be needed, and that I feared that if it was released, it might be used when it would not be needed to be. I think it was right to stand it down because we didn't need it and it could have been used inappropriately. He shared a concern that the document would be controversial and risk poor reaction from the public. It became absolutely clear to me that this was going to be controversial, that it hadn't had the opportunity to be discussed more widely with patient groups, with public, and so my recommendations to the inquiry is that we should absolutely, in future, to try not to and develop one of these tools in the midst of a pandemic. This is a discussion that has occurred to me that has to occur in normal times. It's a discussion that shouldn't be government-led. It should be led by the profession. It needs to be located within society. It is too hard of a task to do at the height of the pandemic. Something tells me the government may have had a hand in this. Nicola Brooks, solicitor at Bullock Johnson Cantor, which represents more than 7,000 families for the COVID-19 bereaved family justice group, said, whilst the tool may never have been rolled out, we know from the evidence the inquiry has heard that the thinking behind it was shared. The result in groups like the disabled and the elderly being written off because it was considered that their lives were not worth saving is a national disgrace. In the 4 years since the pandemic, NHS England and the Department of Health have insisted that blanket decisions about care should be made and have never admitted that a plan was drawn up. Again, another example of dishonesty. The government were dishonest to you. Again, you cannot trust the Conservatives. They're not honest with you. In autumn 2020, the Department of Health and Social Care winter plan said it is unacceptable for advanced care plans, including a DNA CPR decisions, to be applied in a blanket fashion to any group of people. We are aware of anecdotal reports of inappropriate practice in applying a DNA CPRS. This is unacceptable, and we have taken national action across a number of fronts to prevent this from happening. In July 2023, when the Eye revealed that the COVID inquiry was planning to investigate the blanket use of DNARs and clinical fertility scores, an NHS spokesperson said that there was never any NHS directive on NDRs. The NHS repeatedly instructed local clinicians that the blanket applications of NDRs is totally unacceptable, and that access to treatment and care for people should always be made on an individual basis and in consultation with family and carers. So there you have it. The NHS bloody lied. They lied. They literally said there's never been any kind of thing. Yeah, because they asked back in July 2023, the Eye revealed about it, and they said no such thing. Those at the top of the NHS need to be held accountable for. Because we know we can't hold accountability yet to those in government. But perhaps, those in the NHS we might be able to. The decisions were made. Now, how much of this, it looks like it was not put into use in practice. It may have been tested and trialed in some places. It's possible. But they said it was never put into practice. But either way, for someone to be told because of who they are, their age, their fertility, their body weight, or some treatments or diseases that they have, that they are less valued than someone else because that other person over there is much more healthy and stronger, so we should prioritize that person, because that person has a much longer life, and that other person, because they're old and whatnot, we don't need to care them as much. No. Every life matters. Every single person's life matters, regardless of what their age is, what their religion is, what their sex is, whatever it is. They should be all treated equally, and they should all be decided that whatever care and treatment should be done on an individual basis, as it said there by other people, on an individual basis. Even if the NHS was, even I don't care that the NHS was overwhelmed. You treat every single patient with the best action that you possibly can take in those circumstances. I'm just glad that it didn't come to fruition, but still too many lives were lost during COVID. So what do you guys think? What do you guys make of the NHS apparently was looking to do some kind of priority tool? Have you heard of such a priority tool that was used during COVID in any way, shape or form? Maybe it was happening in other countries. Let me know your thoughts and more about this story in the comment section down below. If you found this video informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing, because it really does help support the channel. And if you want to go one step further, financially support me in the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.